Are you or a loved one living with Barth syndrome and seeking ways to improve muscle strength? Discover Forzinity, an innovative medication designed to target the root cause of muscle weakness, offering a new path forward. This video will guide you through everything you need to know about Forzinity, from how it works to how to use it safely. Barth syndrome is a rare genetic condition primarily affecting males. It often leads to significant muscle weakness, impacting daily life and overall well-being. This condition stems from issues within the body's energy-producing centers, called mitochondria. Forzinity offers a targeted approach to address these underlying mitochondrial problems. It aims to restore cellular energy, which is crucial for muscle function. This can lead to improved strength and a better quality of life for eligible patients. Forzinity, with the generic name Elamipretide, is an injection approved for adults and children weighing at least 30 kilograms. It belongs to a new class of drugs known as mitochondrial cardiolipin binders. The FDA granted it accelerated approval, recognizing its potential to significantly improve muscle strength. This medication is administered as a daily subcutaneous injection. Its continued approval relies on ongoing confirmatory clinical trials. Always consult your healthcare provider to ensure Forzinity is right for your specific situation. Forzinity works by targeting the mitochondria, the powerhouses of your cells. Specifically, it binds to cardiolipin, a vital lipid found in the inner mitochondrial membrane. This binding action helps to repair and restore mitochondrial structure and function. By improving mitochondrial health, Forzinity enhances cellular energy production. This boost in energy is particularly beneficial for muscle cells, directly addressing the muscle weakness associated with Barth syndrome. It's a targeted approach to restoring your body's natural strength. Like all medications, Forzinity can cause side effects. The most common ones are injection site reactions, which may include redness, pain, or swelling. You might also experience itching, bruising, or hives where the injection was given. For mild skin reactions, your healthcare provider might suggest topical corticosteroids or oral antihistamines. If these reactions are persistent, severe, or concerning, always speak with your healthcare provider. They can offer guidance and adjust your treatment plan if necessary. It's crucial to be aware of potential serious reactions. Allergic reactions can occur, ranging from a skin rash to breathing problems or a persistent cough. If you experience any of these symptoms, stop Forzinity immediately and seek urgent medical help. For serious allergic reactions, Forzinity should not be restarted. Your healthcare provider may administer epinephrine, antihistamines, or corticosteroids as needed. Always discuss any known allergies with your doctor before starting treatment. Forzinity contains benzyl alcohol as a preservative. This ingredient can cause serious breathing problems in newborns and premature babies. Therefore, Forzinity must never be used in these very young infants. Forzinity is only approved for subcutaneous injection, meaning under the skin. It should never be administered intravenously. This warning ensures the medication is used safely and appropriately for its intended patient population. There are specific situations where Forzinity should not be used. If you have a known hypersensitivity or allergy to Elamipretide or any other ingredient in Forzinity, you must not take this medication. Your healthcare provider will review your medical history carefully. Additionally, as mentioned, Forzinity is absolutely contraindicated in neonates and premature babies. These contraindications are in place to protect patient safety. Always provide your full medical history to your doctor. Barth syndrome primarily affects males, making pregnancy and breastfeeding considerations less common for patients. Currently, there is no specific data available regarding Forzinity use during pregnancy or breastfeeding in humans. Animal studies, however, showed no developmental problems. The benzyl alcohol preservative breaks down quickly in pregnant and nursing women. This means minimal exposure to the fetus or infant is expected. Discuss any concerns with your healthcare provider, especially if you are pregnant, planning to become pregnant, or breastfeeding. Forzinity is administered once a day as a subcutaneous injection. Your healthcare provider will provide thorough training on how to prepare and inject the medication safely. It's important to follow these instructions precisely and read the instructions for use provided with your medication. Always use a new, disposable syringe and needle for each injection. Forzinity comes in a multi-dose vial, meaning it contains several doses. Never reuse or share needles, as this can lead to infection or improper dosing. You can inject Forzinity into your abdomen, at least 2 inches away from your navel, or into your outer thigh. It is crucial to rotate your injection site daily. This helps prevent skin irritation and ensures proper absorption of the medication. Avoid injecting into areas that are tender, bruised, red, or hard. Also, do not inject into scars or stretch marks. Following these guidelines will help make your daily injections as comfortable and effective as possible. Before your first use, allow the Forzinity vial to reach room temperature for at least 10 minutes. Check that the tamper seal on the vial is intact before opening. Once opened, write the discard date on the vial. It must be discarded 8 days after opening. Always ensure you are using the prescribed syringes. Using the wrong syringe can lead to an incorrect dose, which may affect the medication's effectiveness or safety. Proper preparation is key to safe administration. If you happen to miss a dose of Forzinity, do not take a double dose. Simply skip the missed dose and take your next scheduled dose at the usual time. It's important to maintain your regular dosing schedule as much as possible. Consistency is important for the medication to work effectively. If you frequently miss doses or have concerns about your schedule, discuss this with your healthcare provider. They can offer strategies to help you stay on track. Proper storage ensures the medication remains effective and safe. Unopened vials of Forzinity should be refrigerated at 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius. Once opened, the vial can be stored either in the refrigerator or at room temperature, between 68 to 77 degrees Fahrenheit, 20 to 25 degrees Celsius. Remember to discard the vial 8 days after opening, regardless of whether it was refrigerated or kept at room temperature. Never freeze Forzinity, as this can damage the medication. Always keep Forzinity and all medications out of the reach of children. While on Forzinity, your healthcare provider will monitor you closely. They will look for any signs of hypersensitivity reactions or injection site reactions. Regular monitoring helps ensure your safety and the effectiveness of the treatment. Your doctor will also assess your treatment response to see how well Forzinity is working for you. If you have impaired kidney function, your kidney function will also be monitored. Open communication with your healthcare team is vital throughout your treatment journey. The standard dose for adults and children weighing 30 kilograms or more is 40 milligrams, administered subcutaneously once daily. If you have kidney impairment with an eGFR less than 30 milliliters per minute and are not on dialysis, your dose will be adjusted to 20 milligrams once daily. For patients on dialysis, there is currently insufficient data to provide specific dosing recommendations. In such cases, it is essential to consult with your physician. They will determine the most appropriate course of action based on your individual health needs. How quickly does Forzinity work? Clinical trials demonstrated improvement in muscle strength, but individual response times can vary. Discuss your expectations and progress with your healthcare provider. Can Forzinity be used in children under 30 kilograms? No, Forzinity is only approved for patients weighing 30 kilograms or more. There is limited safety and efficacy data for smaller children. What should I do for injection site reactions? Mild reactions can often be managed with antihistamines or topical corticosteroids. Contact your healthcare provider if reactions are severe or persistent. Does insurance cover Forzinity? Coverage varies by insurance plan. Contact your insurance provider or the manufacturer's patient assistance program for detailed coverage information.